Well, good afternoon and welcome. My name is Ellen Phipps. I'm with Aging Together, and it's a pleasure to be here this afternoon for our program. We just have a couple of people on the call today, but as you probably heard me talking about, we're recording this and we're going to get it out there for a wider reach, and it'll be available on our website. So feel free to spread the word about that. It's really my pleasure today to introduce our two speakers. Patricia SLATUM, who is a pharmacist with over 25 years of experience working with older adults to improve medication safety and outcomes. And she serves as the co-investigator of the Geriatrics Workforce Enhancement Program at Virginia Center on Aging and is faculty at VCU. I have taken her medication pharmacy course personally, which several
And you
years
did
ago.
very well in it, by the
Oh,
way.
thank you. But honestly, it was really such a wealth of information, and I learned so much. And so I'm just so excited that she's here with us today. And then, of course, it's also my pleasure to introduce Officer Mike, as we like to call him around here, Master Police Officer Michael Grant. He's been with the Culpeper Police Department since 2008, and he has over 30 years of law enforcement experience, and he's assigned to the Community Policing Division with the department, and he is the motor officer with the agency. I just want to say that Officer Mike does so much in our community for older adults and for the safety of older adults, for support, not just older adults, but really families in general, and every kind of committee and event, and he's there and he's supporting, and we really appreciate so much everything he does in the community.
Thank you.
So, yes. So, without further ado, we'll go ahead and kick off with Patricia SLATUM, and you should be able to share your slides. Oh, and if everybody, let me just say too, if you could just mute yourselves, that will give us the best sound quality. And then if you have any questions, feel free to put them in the chat, and Ginny and I will both be looking at the chat there. So between the two of us, we'll hopefully catch your questions. So thank you, Patty.
Okay, so this afternoon we're going to address the topic of educating before you medicate. And so I thought that was an interesting title that Ellen selected for this time that we have together today. More about our medicines and thinking about our own role in self-managing is so important into getting safe and effective outcomes of medicines. So we're going to talk about a few tips today and some of the things that we might want to consider in helping us to get that most safe outcome from the drug therapies that we take. Let's see. Well, that's if my slides will move.
Are you got your cursor right on it and clicked on it?
Yes.
Yeah.
There it goes. Okay. It was the keyboard seemed to be hung up. All right. So first we'll start off with looking at how this sort of fits in the whole big picture of what we call age-friendly healthcare. As we get older, our needs in healthcare change, and there's a big movement going on in the US and around the world right now to think about what it means to make our healthcare more friendly to our aging. And this has been started by the Institute for Healthcare Improvement and the Robert Wood Johnson Foundation and different groups to think about those aspects that are most important to address in healthcare as we get older. And they call these the 4 M's. And the 4 M's are what matters, medications, our mind, and our mobility. And I think we can all probably agree that those things are extremely important when it comes to getting a good benefit from our healthcare. And so I just want to point out that medications is one of the pillars of getting good healthcare as we age. And why are we particularly concerned about medicines as we get older? And as many of you I'm sure are aware, our bodies change as we get older. And this influences how our body responds to medications, both the benefits that we might get and also the side effects or problems that we might experience. So when we give a dose of a medication, it causes some concentration of that medication to be in our bloodstream. And then that concentration in our bloodstream causes a response. So as soon as the drug goes into the body, our body starts taking it out. We metabolize it by our liver, our kidneys, the drugs distribute around our body tissues, depending on fat and water solubility, and all these sorts of factors that are changing as we age. So generally, our ability to metabolize drugs does decline, and our ability to remove drugs from our body by our kidney declines as we get older. And that said, for a given dose of a medicine, we might see an exaggerated effect if these drugs are staying around in our body longer than they did when we were younger. But there's also then how that concentration in our bloodstream causes a response to happen. And that response could be something positive, like prevention of a disease or relief of pain, but it could also be a side effect. These responses can be different too because other systems in our body are changing. So our nervous system, our brain, gets more sensitive to the effects of medications as we age. Our cardiovascular system, our ability to sort of keep our blood pressure up when we go from sitting to standing so that we don't feel dizzy. You know, the older we get, the more likely we are to experience things like dizziness when we first stand up. And that's because of changes that are happening in our cardiovascular system. Our musculoskeletal system and how well we're able to stay upright, our gait and our balance, all can be impacted by the aging process, and our immune system. And I think we're all hearing a lot about that right now during COVID, especially when we think about how aging is affecting whether vaccines are working and whether we're susceptible to the COVID virus, right? So our immune systems also change. So all these changes are occurring, and they are associated with getting older, but not necessarily caused by aging, right? So we just sort of can have this in our mind that things are not staying the same. And that means that what we experience from a medication in our younger years, our middle-aged years, may not be the same thing that we would experience from the same medication in our later years. And as a recently retired person myself, I can say that this is true. The effect of medicines I notice on my cardiovascular system are not the same as they were when I was in my 20s, okay? And all of aging happening,
Patty, you are breaking up
our,
a little bit. So you may want to go ahead and
okay,
turn off your video. It's kind of breaking
okay,
up. So that if you think that'll
okay.
help, let's try that. Thanks.
All right, great. So we're talking about chronic health conditions and how they also increase as we get older. So if you look at data that came from the Center for Disease Control, and the National Council on Aging has kind of summarized this nicely for us, is that there are 10 common chronic conditions that we begin to experience more frequently as we get older. Our blood pressure tends to be higher, our cholesterol tends to be higher, we're more likely to have asthma, heart disease, diabetes, kidney disease, etc. Okay, so these conditions do get more common, but what's interesting is it also becomes more common to have more than one of them. So 80% of us, when we reach the age of 65 and older, have at least one of these things, but 70% of us have two or more. Okay, so what it ends up causing, I think, having all of these conditions begin to accumulate, is that we become more and more different from each other in the combinations of chronic health conditions and medications that we take for them. And so there's a lot of difference from one person to another, even at the same age. And these chronic health conditions also have an impact on the medications that we're prescribed and how well our body can handle them. And when you have more chronic health conditions, you might expect that we would see polypharmacy, which means taking multiple medications. And I just wanted to point out that this group, the Lowen Institute, did a report, which I found pretty interesting to think about. They looked at the data between 1994 and 2014. So over that span of time, in 1994, 14% of people who were 65 and older took 5 or more drugs, which would be called polypharmacy. By the time we get to 2014, it's 42% of people 65 and older. So not only are there more of us in the 65 and older age group, but we tend to take higher percentages of us take 5 or more drugs. So we are awash in medications, I think, as we get older. And it's an experience many people have, where every time we seem to get to a doctor's visit, there's another prescription. And so the real task is keeping these medications in the right balance. Medications are important for maintaining health and preventing illness. They've been responsible in part for the longevity that we're experiencing as a society. But we also know that there is this other side, the other part of the balance, and that's making sure that we're not experiencing medication-related harm. And I love this quote. It's pretty dated now, but it's still applicable. And that's that any symptom in an older patient should be considered a drug side effect until proven otherwise. And this was written by a friend of mine who's Jerry Gerwitz, who is a geriatrician at Harvard. And it's still true today. We should be suspecting medications as problem causers as well as problem solvers in our aging process. So I thought what we could do today is because we know that as we age, we're at higher risk for problems to happen from our medicines. What are some tips for using medicine safely? And in our short time that we have today, I've picked out 10 tips that we can focus on for this afternoon. And one is bringing a list or a bag with all of our medicines when we go to a healthcare provider, pharmacy, or hospital. So having an accurate medication list to share with all of our providers helps to prevent running into a problem due to lack of information by any provider, so that we are less likely to get a medication prescribed that interacts with one we already take. We're less likely to get duplicates of therapy when we're already receiving a treatment for something and we don't get 2 of them. And I've certainly seen this in my own practice, where you can end up on 2 sleep medications, you can end up on things that really were never intended to be given together because of lack of communication about what the list is, okay? So I like to, as a patient, encourage being the keeper of the list. And then I share it with every provider that I see. So I make sure that they know. And this list should include the over-the-counter medications, dietary supplements, vitamins, herbal products, all of it, so that it can be really all assessed together every time a decision is being made about whether to take a drug away or add one to the drug regimen. Yeah. And there are resources for making this list. There are fillable forms online, and I have links to that at the end of the presentation. So you can get resources for making it easy to type in the list, or asking your healthcare provider to provide you a list that you then add your home medications and over-the-counter products to as well. The second tip, ask questions about your medicines. I think medicines can be pretty intimidating, especially when you pick up that brochure that comes with your prescription that's got about 1 million things listed in it in a lot of technical terms. And it is okay and perfectly appropriate to ask, what might I expect from this medication? Are there issues I should be concerned about? To talk about how long the therapy would be intended to be. How would I know if it's working? All these kinds of questions, and whether or not it has an issue with any of the other medicines you're currently taking. These are all very important things. And I think it can feel intimidating sometimes in our encounters in healthcare to bring these concerns up. But I encourage you to think about that it's your body and you're the one taking the medicines, and it's perfectly okay to ask these questions, right? And sometimes you need the information in writing so that you can think more about it later. But being able to ask your questions, even if they come up after the encounter, you can always call a doctor's office or a pharmacy back with your questions. The third tip is making sure the medicine that you get is actually what your healthcare provider ordered. And I'll just say there's lots of room for errors in the prescription going from your healthcare provider's head to decide, and you deciding with them that you need to start a new medicine, to making sure that what you're taking is correct, that the instructions are correct, and that the right thing is in the bottle. So I always advise checking prescriptions when you pick them up to make sure it's the correct thing. If it looks different than the last time you picked it up, ask why it looks different, because sometimes it's a mistake. I would say that errors are not super common, but they happen. And this is a role we can play to help things be more safe. I think for tip 4, asking how you can use your medicines correctly. And this is about the timing of medicines, whether or not they should be consumed with food or not, whether you can crush them for someone who's having difficulty swallowing. Not all medications can be crushed, and it may not say that on the bottle of prescriptions. So please ask if you're going to do something like that. If you're going to change the time of the day that you're using a medication different than what it was prescribed, it's important to ask what might the implications of that be. There are medications that should not be taken at the same time together. An example would be thyroid medications and calcium supplements. And I've been in community presentations before where people tell me they've never heard that before and have been doing it for a long time, right? Using things at the same time that maybe shouldn't be. So understanding how to use medicine correctly. And I'm the first to admit that all of us in healthcare could do a much better job of making this clearer. So when a medicine says to take it 3 times a day, what does that mean? Does it mean every 8 hours? Does it mean with breakfast, lunch, and dinner? Does it mean when I first wake up, sometime in the middle of the day, and before I go to bed? The answer to that depends on the medicine. Which of those would be a preferable option? So really understanding how to take the medicine correctly, how to use the inhaler device, how to administer the insulin and measure it correctly. All of these are pieces in knowing how to do it correctly. And so please don't be afraid to ask how to use medicines correctly, because it isn't always so evident in the materials that you're provided at the time. And I've even had, my personal friends or family members call and say, hey, I got this new medicine and I have no idea how to put this device together. I mean, I've looked at the instructions, but it doesn't make sense, right? So if anything like that comes up, please reach out and ask. And tip 5, asking about possible side effects. This is always tricky because a lot of side effects from medicines are rare. Some are common, right? And the risk of having them does increase as we get older because of these changes that are happening in our body and the fact that we maybe have multiple health conditions and also taking multiple medicines. So we are at greater risk for having a side effect. If something is changed after you take a medicine, just assuming that you need to put up with it or that it's not related to the medicine, I would definitely raise your concerns. And medications can cause unusual side effects for older people. things like experiencing a fall that on the surface we might not think is related to our medicine, but medicines can increase the risk of it happening. And if something like that occurs, we want to make sure that it's not drug related, because medications are usually modifiable. We can do something. We can change the dose. We can change when we give it. We can change to a different medication. So paying attention to what happens after you take a medicine and sort of understanding what you might expect are important and good questions to ask. All right, we're moving into the home stretch now. We're in this half of tips. We're moving to number 6. This is about high-risk medications. So there are some medicines that are just riskier than others. We use them because the benefits are also very high sometimes, or it could be that the risk often outweighs the benefit for older persons. And a good example is blood thinners. They've been life-saving in preventing strokes and pulmonary embolism and all sorts of problems of blood clotting, right? But if you get too much of it, it can make you have to be in the emergency room or the hospital. So we have, these medications are then considered high risk, and we have to pay careful attention to how we're using them. It actually matters if we miss doses or we accidentally double up on a dose, these sorts of things. Medications that lower blood sugar for diabetics. This is another, medications, if the blood sugar goes too low, it's dangerous. And so knowing how and when to use them and what to do if the blood sugar goes too low, really important, right? We also understand that some medicines are generally much higher risk as we get older. Sedatives and sleep medications are an example. And sometimes these medicines have been used for a long time, but as we get older, it's harder to tolerate them. And I would say that sedatives should be our last option for treating sleep problems after we've exhausted other approaches. And pain medications fall in this same category, where the risk associated with using them actually increases as we get older, so that, especially I'm thinking here of the opioid analgesics. So that would be, your medicines like OxyContin and things like this. They do get riskier to use, the increased risk of falling and maybe impairment of our thinking and stuff like this. So we think of them as high risk, and mixing the sedatives and pain medications together is particularly high risk. And I'm guessing that Officer Mike might share with us a little bit about, prescribed medications can still be, can still cause us immense harm when they're not used properly. If they're used too much, or they're mixed with other things like alcohol, can be life-threatening, okay? So being cautious of these high-risk medications is important. Tip 7. My tip 7 is try non-medications approaches before you try meds whenever possible. The goal of reducing, only using medications that are necessary. It's really important. And oftentimes the alternative to high-risk medications like sedatives are non-medication measures like meditation and not watching TV in the time before bed and not having caffeine after noon, and lots of things that we can do. And so talking with your doctor about non-medicine approaches to try first, I always recommend that. That's not always going to work, because some things we're going to need a medication to address. But for many things, especially that are symptoms or kind of chronic problems, they can be addressed without medicines. That takes work, and we have to be committed to doing those non-pharmacologic measures, as we call them, the non-medication approaches. So they may take some work, but in the end, they're much lower risk than taking medications for those problems. And they often work better. And no one believes that up front, but when you try them, turns out that the non-medicine approaches can be as effective or more effective than using the medicines, especially over the long term. So what about tip number 8 here? Ask before using over-the-counter medications or alcohol along with the prescribed meds. I brought this one up because even in the time of the pandemic, we're seeing more and more use of alcohol across all age groups, and aren't always seeking advice about whether it is okay to mix that alcohol with our prescribed medications. So mixing alcohol with some medications can cause us to have adverse reactions like flushing reactions in our skin and feeling very uncomfortable. But it can also be things like falling, increased fall risk, or our blood pressure going too low. These are all potential outcomes of mixing alcohol with prescribed medications. And the ones that we're most concerned about are those medications that affect our brain. Things like opioid analgesics, the Oxycontins and the whatnot, or the medications like benzodiazepines. And here we would be thinking about things like Xanax or Ativan or Valium, that are medicines that they're muscle relaxing, anti-anxiety, and also sedative, that are particularly dangerous to be mixed with alcohol. So alcohol is one issue, and then the over-the-counter medications. Reading the package of over-the-counter medicines before starting them is important, but interestingly, not all of the information that you might need as an older adult to make a decision about taking over-the-counter medications is apparent on the label. You know, it's like because of these changes that are happening in our body and the other medications we might be taking and the chronic health conditions we might be experiencing, our situation gets more individualized than the broad warnings that are put on the label. So it's very good to ask if there are any issues, interactions with other medications or whatnot before consuming, because it's, I was recently working with a patient whose over-the-counter medicines caused him to have an acute, what they are like an urgent kidney, his kidney just shut down because of it. And it was an over-the-counter medicine that none of his healthcare providers knew he was taking. And so asking first, that warning was not necessarily on the package. Your kidneys might shut down, right? It didn't say that, but he was at high risk for other reasons. And so very important to ask, educate before you medicate, especially those we're making self-judgment about. So tip 9, clarifying instructions anytime we leave a hospital, ER, or if we go into a long-term care setting because of maybe rehab after an injury or something like this. Whenever we're transitioning from a hospital to home or the hospital to the rehab facility and then home, every time we switch settings, there's a great opportunity for everything to fall apart in our medicine plan. So it's really important to clarify what I'm supposed to be doing with my meds when I leave these places. And in all the haste of getting out of the hospital, just making sure that's clear. And what am I supposed to do about the medications I was taking before I went in the hospital? Am I taking these new ones? Are they substituting? Are they in addition to? All these questions start coming up for people after they leave. If they don't have a good, clear plan and discussion before they go. And I think it's very important to ask for it if it's not happening in a way that you and the person's helping you at home are understanding it, right? So it's just a high risk time. So a good time to be an advocate for yourself, I think. And tip 10, our last tip for this presentation is clean out that medicine cabinet regularly and dispose of the unneeded medicines safely. And I say this because we all accumulate up stuff, whether it's over-the-counter medications that we didn't finish the course of or something changed and we think we might need it someday and we keep it. We all have it. I even have it for my pets, right? So these medicines start accumulating. It's important to clean them out for a couple of reasons. One is that you don't want to use expired drugs. So getting things out of the cabinet that are beyond their expiration date is because they might not work very well if they're no longer effective because they've been breaking down over time. So really old medicines, I wouldn't take them. Secondly, other people can get their hands on them. And this is particularly important with the opioid analgesics or anything that can be a substance that's misused by others. So we keep that tramadol that was prescribed for our dog sitting in the cabinet. It's very tempting to a teenager to take it, or the housekeeper, or someone who's coming in, right, to use it. And because those drugs are so highly misused, it's just not wise to keep them around just in case. And so we recommend cleaning it out. And you can dispose of these medicines at drug take-back days that are offered in the community. Sometimes pharmacies will take them back. There are different ways to dispose of them, and I have some resources at the end of the presentation. But that can be a homework assignment for today. Clean out your medicine cabinet, make sure you have a list of all your medicines, and take the next steps into making this a whole much safer venture in using them. Because I do think our healthcare system relies on us in large part to be advocates for ourselves and to self-manage what's going on. So these are little tips we can do to help make this whole process run more smoothly. And I have some additional resources here. The first one is the Safe Use of Medicines page from the National Institutes on Aging. And they have forms and things on there that you can use to create your medication list and print it out if you would benefit from something like that. And they also have a lot of information about specific medications, about questions you might have. There's also a program called Mind Your Meds, Medication Safety, that was put together by the HQIN here in Virginia. They serve multiple states, so it's also in the Carolinas Center for Medical Excellence. But that is a brief little video program that you can watch that talks about preparing for your doctor's appointment and getting your list ready for your medicines. Okay, so that's a nice short video that you could take a look at. And then there's one called Mind Your Meds, Safe Opioid Use and Disposal. And this one walks you through how to get rid of those unneeded medicines. It's about a 6-minute video with actual resource pages, depending on the medicine, how it's best to dispose of it. Okay, so that's kind of helpful too. And then I just wanted to make sure you knew about this website called Be MedWise. It's produced by Needy Meds, and it's got great resources if you have trouble affording medicines. But it also has some really great safety tips on it, a lot more than we've had time to go over today. So if you are interested in even more tips in improving your self-care, that's a great place to start. And lastly, I'll mention health and aging. The American Geriatric Society has a consumer-facing foundation that produces nice materials about medications and medication risks as we age. It has sort of short informational materials about medications to avoid as we get older, using over-the-counter medications and supplements, just some tools that you can take a look at that might be helpful. So I list a few of these just so that you have some places to go afterwards if you want to learn more. And don't forget what your homework assignment was, which is to clean out the medicine cabinet and make sure you have a medication list before your next physician appointment. So with that, I want to turn it over to Officer Mike to share some information about opioids and other issues in the local community, and then we can address questions. Does that sound, or do you want to do that now, Ellen?
Let's just maybe take a pause for a second and just see. I know there have been some things going on in the chat here. People are very interested about to know about the resource list, and actually, I think we'll be able to email that out to everybody. And are you comfortable with us sharing the slide presentation?
Oh, absolutely.
Okay,
So
because I,
you
yeah,
can share the, yeah, which has the links on it with people. That would be
yes,
fine. Mhm.
yeah, okay. So we can do that as well. So
Yeah, and the fillable list is actually, there is one available on the NIA webpage, and there's also one available in this medication safety presentation from HQIN. It has a handout that is the fillable form for your medication list. So
that's
there's two
great.
resources on here that have fillable forms. Yeah. Mm-hmm.
Yeah. Well, this is such great practical information. So really, really appreciate that. Does anybody have any burning questions for Dr. Sladen before we move on to Officer Mike? And you can either put those in the chat or go ahead and unmute yourself. This very helpful. Excellent.
These
Thank
tips, these tips are sort of practical things, but I think we sometimes forget. While I was putting this together, I just opened my own medicine cabinet and went, "You have some homework to do, Missy."
you. You know, and you know, that's such a good point. And I'll just say that I recently went into my medicine cabinet to take like an antacid. And before I took it, I thought, oh, I wonder what the date is on this. And it was like 2 years out of date. And I'm like, how did that happen? I feel like I just got it. So I think that it's such an important thing, and that primarily I think we don't realize how quickly the time goes by and these things expire. So I think that's
Yes.
great homework, and I'm going to do the rest of my medicine cabinet too. But
Nice.
we'll go over to Officer Mike. Thanks so much.
All right, thank you. Very good presentation, like that. And it's a good point. I teach a class, home security type thing. And one of the steps is to medication not to lay around. Like you mentioned, kids come in and take it, they either take it themselves or they sell it. Grandparents or older folks don't realize that medicine's, they're live by themselves. So they take medicine in the morning and they do it in the kitchen, they leave it there. In the afternoon, they take medicine and it happens to be in the living room, they leave it there. And they have medicine all over the house. And, you know, unfortunately, kids or visitors or whoever comes in and spots that, they'll take 4 or 5 pills. Well, they don't realize 4 or 5 pills are missing. And then one thing leads to another, and that's where, you know, it develops into different stuff. So that was a good point that, you know, to do that. Be careful where you're putting your medicine, and especially the expired medicine. Some departments and some areas we have a take back drug box in our lobby. So you can bring expired pills anytime you want to our lobby and just drop them off in the box. So that's a very good point. I'm just going to talk very briefly and very quick on opioids, and kind of follow up on what Patricia said. The opioids are a class of drugs naturally found in an opium poppy plant, and the work in the brain to produce a variety of efforts, including the relief of pain of many of these drugs. Opioids can be prescribed medication, often referred to as painkillers, or they can be so-called street drugs such as heroin. And many prescription opioids are used to block pain signals between the brain and the body, and are typically prescribed to treat moderate, severe pain in addition to controlling pain. Opioids can be, some people feel relaxed, happy, or high, and can be addictive. And that's the important word right there, is addictive. Even though it's a prescribed medication, it can still be addictive. And that's what you got to be careful of. And it includes slow breathing, nausea, confusion, drowsiness. And in our area, 5 County, in our particular town, since the first, we've had 3 deaths and 2 injuries. Overall, there's been 9 deaths and 18 injuries. Way too much. People just don't understand how quick and easy you become effective. And like Patricia said, there's a whole list. Go to John Hopkins meds, and there's a whole list of medication that you're taking that actually are opioids that you can become addicted to. You know, what is the opioid problem is about 115 Americans die each day. And I repeat that, 115 Americans die each day from overdosing on drugs, so-called opiates. again, way too much. People are taking these medications. Sometimes the doctor don't explain what these medications are or how it'll affect you. So you got to be careful on how you take these drugs. And the heroin and so forth is, obviously everywhere has become very, very addictive and challenging to everybody to try to, control and take care of what's going on. The question becomes, what's the treatment? Well, basically, there's only two treatments. You either get an out-based type treatment or you get an in-house treatment. I guess depends on how severe or how you want to try to fix your addiction or however you want to do it. Most insurances will cover it. You just got to make sure you talk to your insurance company before you start that process and see what they will cover and what they won't cover. Many departments are carrying Narcan. We were one of the first departments to carry Narcan. Our whole department carries it. Each officer has one in their car. I am the only officer that does not carry it because I ride the motor, and you got to temperature control it. And obviously on the motor, I can't control the temperature of it, but every other officer has it. And we've had many successful incidents where we brought back that patient and was able to save them. So we do that. You take, it only takes a couple of weeks to become physically dependent on an opioid, but it varies by individuals. You could take an opioid one or two times. It could be a problem. Generally it's not if you take it one or two times. However, in some cases have showed that the first dose can leave you psychologically affected. And you just got to be careful when you take these drugs, what you're looking for and how they're doing it. So when you go and they're going to ask you how you're going to take this, ask the doctor, do I need this many pills? Do I have to have these pills? Is there an alternative to taking this type of drug? And ask those questions because there may be an alternative and you won't have to worry about this. The sad thing is a lot of people don't know these drugs they're taking are opioids or addictive right away. And that's one of the things. If you have a loved one, friend, whatever, and some of the signs, inability to control the usage, uncontrollable cravings, drowsiness, changes in sleep habits, weight loss, frequent flu-like symptoms, lack of hygiene, change in exercise habits, isolation from the family or friends, stealing from the family, friends, or businesses, and they end up having new financial difficulties because they're starting to sell things or they're borrowing money or however they got to do this addiction. And it's unfortunate for our seniors. They're taking medication for whatever it may be, but they don't realize that some of this medicine they're taking is these opioids. And, they take it like they're supposed to, but you take it over a long period of time, you just don't know. Each person's different, but it can affect you different ways. So the bottom line is make sure when you go to the doctor, if you have a severe issue, you have some type of surgery or those type things, ask those questions. Why am I taking this drug? What's this going to do for me? How long do I have to take it? Those type things. There's an alternative to taking this type drug to the next drug or therapy or whatever to stay off these. And like I say, unfortunately, a lot of these folks don't realize which drugs they're taking are actually opioids in those. And like I say, you go to Johns Hopkins Med, there's a whole list, like Patricia said, of medicines that you wouldn't think about that would, and of course, like she said, oxycodone, Vicodin, the big drugs, they're obviously are the main ones. And people sometimes, we are not used to pain. So when we have pain, we want to get rid of that pain, however it takes. And doctor gave me this medicine, so I should be able to take it. And you just take it. And sometimes you don't go really by what the label says because you don't feel good or that pain's starting to come back. And well, if I take an extra one, it's really not going to matter. Well, yes, it will matter, and it matter a lot. So, make sure if you do take it and you are comfortable taking it, make sure you do what the bottle says or what the doctor how he tells you. If you start feeling different, tell the doctor, hey, something's not right. I mean, it takes the pain, but I get this effect, you know, whatever the symptom may be. And he may change it, he or she may change it. So just be careful on what you're taking and how you're taking it, and ask those questions, you know. Do I need this drug? Do I need that many of them? Why? You know, that type thing. So other than that, that's a quick overall of how these drugs work, and kind of just following up on what Patricia said. And like I say, the big thing is be careful where you leave your medicine, clean out your medicine cabinet. And if you have a lot of drugs, take them and bring them to I'm not sure about the hospital. I'm not sure if they take them anymore or not, but I know most police departments or sheriff's departments will take them and dispose of them.
That's good to know.
I completely agree with that. And you know, it's like, especially after an acute injury, like a fall that results in an injury, and then you get a few of these opioids, you often get more than you need. Right? Even though we're getting more and more cautious about prescribing them. And so, you know, there are circumstances like cancer, end stage. It's very painful. We use these drugs very effectively, and they do improve people's quality of living. And I think there are times where the use is appropriate. It's just making sure that we're not unnecessarily or off of the instructed way or hanging out with the extra ones, you know, just there's things to do to make it safer. I wouldn't say that they're horrible in every circumstance, but I think we do have to remember that they just carry a high risk as well as the benefit they might be providing.
You know, you raised a really good point there that I was going to ask. Both of you, have you seen better prescribing habits from the medical profession since we've become a little bit more aware of the crisis? And I'll call it a crisis because I know it's been a crisis. Have you seen changes there?
There are reductions in the prescribing of opioids in a lot of circumstances, to the point that it's hard to know if it's been always better. So people who've been taking pain medications chronically and successfully at home have had their, you know, medications just cut off, right? Things like this, so it's hard to know that it's always been better or whether it's been targeted appropriately, but I would say the overall reduction is a benefit. And we were awash in too many opioids. We had plenty of examples, just the lawsuits and everything else that's been in the news. There were just too many of them being prescribed and inappropriately. That is starting to curb back. We just don't always get it exactly right. You know?
Officer Mike, thank you.
Uh-huh.
Have you seen any decrease in, I mean, you had quite a number there, quoted 9 deaths in our region. Is that more or less or about the same that you've seen over the years? That seems like a lot to me.
Well, it is a lot. And I don't have the statistic for the past. I was just looking to see what we've done.
Yes. Yeah.
First, but you know, and those are all from not prescribed medications. They're from use and that's type things.
Gotcha.
One thing I didn't mention is the addiction is not simply like a disease such as like pneumonia. There's not a magic bullet that cures the person like an antibiotic could cure pneumonia. We think of opioid abuse as a medical illness, not a disease. It's more of a medical illness. And
and it's a chronic condition.
Yes. And
yes. So even when you don't have access to that opioid anymore.
Right, exactly. Yeah. So I can tell you, I don't see the prescriptions. I know when I was working on the cover, we did a lot of prescriptions. Doctors were just writing them, and people knew what doctors to go to get these and so forth. I don't see much of it anymore because I'm not in the law enforcement anymore, but I don't hear the guys talking about it too much anymore either. But because they've cracked down on that pretty good. You know, if you write a prescription, it's pretty well tracked. And Patricia would know better than me, but it's pretty well tracked through the system as to who's writing it, and they all have codes on them and all kinds of things. So it's gotten better over the years to track a prescription and who's writing it. And, you know, if you write 40,000 prescriptions in 6 months, just for figure, you know, somebody's going to flag that and say, hey, you're writing probably a few prescriptions. Why are these going here, there, and everywhere? So they've cracked down on that. They've done a good job.
Yeah.
Well, and the use often starts with those prescribed ones, right?
Yes.
But then it quickly can move to the illegal. And, you know, fentanyl is just, it's so
Now,
readily
fentanyl-
available. It is so readily
Yes.
available that.
Now, fentanyl is a drug in itself. If we encounter somebody that we think is dealing with fentanyl, we automatically glove up, put it in an evidence bag, seal it, and send it off. We don't touch it. We don't test it. We don't do nothing with it, because fentanyl is 50 to 100 times more powerful than heroin. So they use that drug, and the other name I can't think of off the top of my head, but they use it as a tranquilizer for elephants. So you imagine if you take too much of that fentanyl, I mean, you don't have a chance. You know, it's just
Mike, can you talk a little bit about the Narcan? Because I'm just curious, is that something that we can purchase, and do we need training for it, or what does it do exactly?
It's there is training out there. A lot of individuals carry it now with them. There's training all over for it now. You can just look it up in different departments, different agencies, different. I'm trying to think.
Your local health department will
Health
do
department. That's what I was trying to think of.
Revive
Health
training,
department.
it's called. Yeah.
Okay.
They do it, and so we find somebody that's unconscious. We'll give them a dose of Narcan, and it should react to whatever opioid they're taking and bring them back around. Sometimes it takes a couple doses, and unfortunately, sometimes it don't work at all. But two reasons for that: one, if it doesn't work, it doesn't hurt to give it to somebody. It may not be what's wrong. They may be actually having a heart attack, and they're not overdosing. So if you give somebody a shot of Narcan and they don't react to it, now you got to think real quick, which way am I going to go with this? I mean, I did that and didn't have a reaction. Ended up by doing CPR and brought the fellow back, but he was actually having a heart attack. It wasn't an overdose. So you just got to be thinking real quick on your feet when you administer it. But they are, like I said, the health department trains individuals on available.
Yeah, and
time it was pretty expensive. I don't know how much the cost is now for it.
somebody, Chelsea, just uploaded, it looks like it's in the chat, a document that we can print or save that's a Revive free Narcan drive.
Okay.
Feel free.
It's a flyer. It's a flyer.
Can you see
Yeah.
it?
Yes. Yeah. Should we
Okay.
touch Christy? Yeah. Okay. Well, I think you made another really excellent point that I think we see quite a bit here. I think a lot of times people, older adults, don't realize that the drug that they've been prescribed is an opioid, or that, yeah, I mean, I think that is really, really significant, you know. You almost feel like there should be some kind of big red warning on the label or something, that says, make sure you know what this is. But I think that's a real issue for a lot of people. They just don't know what it is they've got there.
No, and I've noticed that the pharmacists are becoming really good at, when they give you your medicine, they ask you realize what it is, or you need any questions, any concerns, or I know they do at my pharmacy. If they give I've been in line and heard them say, they'll give out a prescription and say, do you understand what this is? You have any questions for the pharmacist, so forth, so on. So they're getting good at explaining to the customer that, hey, do you understand what you're taking? And of course, all prescriptions come with that label, which of course nobody reads, but it does come with all the side effects and how to take it and that type thing.
Yeah.
Yeah. That's that just taking the attitude or the approach that you have a big part to play in this whole self-management process. It can't be passive. Not and be safe, really. So it is important to educate yourself about what you're taking and not just accept whatever is handed to you. Yep.
There's some
Well,
good phone numbers that Chelsea just put in. I wanted to,
can you copy those down, Ginny? Are you
Um,
able to get or print them
I
off?
will
Or,
try to get the chat at the end.
oh,
Uh,
awesome.
But
Yeah,
it's, you know, you got to understand too, nobody's perfect. I mean, even a doctor or farmer can make a mistake. So
Yep.
get your medicine. You want to look at it and read it and make sure it's the same as the last bottle you just had or any changes. I mean, I got some the other day, it was a different color. And I like flipped out. I called the pharmacy, what'd you
Yeah.
give me? They were white, now they're green. I mean, well,
yeah.
companies change, you know, or their supplier changes, so they change the pill. Same pill, same dosage, just different color. But I still called and said, you know, hey, this one was white, this one's green. I mean, did I get the wrong medicine or what happened here? And you don't know the, you know, the company changed and or supplier or whatever. So just make sure what you're getting is on that bottle is what you got, you know, dated or whatever.
Yeah.
Such great, such really good, excellent information, both of you. Thank you so much. We've got about 4 minutes left. I just want to make sure that if anybody does have a burning question, either for Patty or for Officer Mike, go ahead and put it in the chat or unmute yourselves. If you think of something afterwards, I know where to find these guys, so you can email us. We'll track them down and ask your questions. So I just want to make sure everybody has one last chance to get your questions answered. Well, I just want to thank you both so much. I felt like it was just so easy to understand and to follow. Some information coming back here, great information on the chat. Really appreciate it. We're going to put this up. We're going to try to get this video out there, spread the word, because it's really, really helpful, practical, and raising awareness. So thank you both so much. Thank you for those who joined us, had your own private little session here today. And thanks to Jenny Biggs with Aging Together for all she does. And just stay in touch with us. Visit our website if you want more information about our programs at agingtogether.org. So, thanks.
Thank
Well,
you,
thank you
everyone.
very much.
Hey, Jenny,
Yes, sir.
Jenny, don't
Yes,
go
sir.
nowhere. Don't go nowhere.
Okay. Thank you, Patricia.
Yeah.